to you, Dr. Goldstein. How does information or knowledge about the endocannabinoid system, how does that inform your work? What does it mean in a practical sense as a clinician?
So, in practice, it's interesting, over years talking to patients, thousands and thousands of patients, you start to see this trend with people describing certain symptoms that you can then start tracing back to the endocannabinoid system. So whatever it was, whether it was an injury or an illness, inflammatory condition, some type of traumatic insult, patients have very similar underlying symptoms, such as, my anxiety is out of control, my sleep is terrible, I'm angry, I'm sad, I don't feel well, and it's kind of like this, the whole being is not well. It's not just, oh, it hurts right here. Now, we do get those patients too who have very specific, but what I have found is that for so many of the patients, that especially those with long time, what we call chronic, ongoing conditions, and they've never felt well. And you ask when you're a doctor, okay, what have you tried? And people will kind of rattle off, I've tried this, and I've tried this, and they list all these medications, and I kind of joke around and say, okay, that's like saying I broke my toe and put a Band-Aid on my shoulder, right? You're not targeting the underlying system that is now out of whack, and that's your endocannabinoid system. And if you don't target that system, you're going to be taking medicine or doing things that are all around, but you're missing the target. And so when people come in and, for instance, they'll give you that symptomatology, you say, oh, that's your endocannabinoid system. And they're like, what? What are you talking about? I never heard of that. And it's unfortunate that doctors aren't learning about this. In my own family, I have a relative who has seen an orthopedist, a rheumatologist, an endocrinologist, a pulmonologist, and I kept saying, stop going, because all of a sudden you're now finding all these conditions, and really it was cannabis medicine that took care of everything. Now, I'm not saying that's going to be for everybody, but certainly when you're seeing that kind of progression without finding the answer, certainly you must think of the endocannabinoid system.